We are on day 20 of our New Year's Healthy Habits series, and today we're going to be looking at the pillar of lifestyle medicine, restorative sleep. And we're still in our evidence-based medicine week, so once again, we're going to be analyzing a piece of literature, taking a look at some of the results as well as limitations surrounding our restorative sleep pillar of lifestyle medicine. So let's get started. The article that we're looking at today is titled Restorative Sleep Predicts the Resolution of Chronic Widespread Pain Results from the EpiFund Study. So let's kind of dive in and see what this study is actually taking a look at. So the population are individuals aged 25 to 65 years old with chronic widespread pain, which is going to be abbreviated as CWP in this study. From a population-based study in Northwest England. So that's where it's taking place. It's the intervention that we're going to see is the assessment of sleep quality using the estimation of sleep problems scale. So this is a kind of a survey that will be used to evaluate sleep quality in each of these individuals in the study. And then our comparison is sleep quality scores among individuals who resolved their chronic widespread pain versus those whose chronic widespread pain persisted. So basically, some individuals will have resolution in their symptoms of chronic widespread pain, and we want to see what their sleep quality scores look like compared to individuals where their pain persisted, and the outcome is going to be this resolution of chronic widespread pain at a 15-month follow-up. So let's just take a look at the 4-item sleep questionnaire that these individuals were asked to fill out, and that's going to be on the right side of the page. So the 4 sleep kind of criteria that were evaluated was number 1, sleep onset, and the question that these patients were asked was, during the past month, did you have trouble falling asleep? The second question was about sleep maintenance. During the past month, did you wake up several times per night? And then early wakening. During the past month, did you have trouble staying asleep, including waking up far too early? And then the fourth question had to do with non-restorative sleep. During the past month, did you wake up after your normal amount of sleep, feeling tired and worn out? So on the left-hand side, I have some of the results of the study, and let's take a look. So sleep quality and the resolution of CWP, or chronic widespread pain subjects, in the lowest third, those who reported the best quality sleep, were 60% more likely to have symptoms that resolved. So higher quality sleep and resolution of chronic widespread pain were correlated here, and we can see that our confidence interval does not include the number 1, so this was actually statistically significant. Next, we have 3 out of 4 sleep criteria were statistically and significantly associated with the resolution of chronic widespread pain. This include rapid sleep onset, absence of early awakening, and restorative sleep. So these 3 out of the 4 items on this 4-item sleep questionnaire were directly associated with the resolution of chronic widespread pain at the 15-month follow-up. So very interesting there, how sleep can and quality sleep can be related to the resolution of pain. And then in comparison with the chronic widespread pain subjects whose pain persisted, subjects whose chronic widespread pain resolved had significantly lower baseline levels of anxiety, depression, physiological distress, somatic symptoms, illness behavior, and health anxiety. So a bunch going on in that little bullet point there, but basically saying that in individuals whose chronic widespread pain persisted or who did not have resolution of their symptoms, they had higher levels of anxiety, depression, somatic symptoms, physiological distress, and the way that they analyzed this was using a bunch of different scales and scoring systems. So, for example, for anxiety and depression, they used something called the HAD scale. For the ability to analyze physiological distress, they use something called the General Health Questionnaire, a 12-item questionnaire used to measure psychological distress. And for somatic symptoms, they use something called the Somatic Symptom Checklist. It's a screening tool that's often used in doctors' offices. So again, just a lot of research and a lot of data going into this, but it really shows that, first, that sleep and sleep quality was significantly related to resolution of chronic widespread pain. And then additionally, resolution of chronic widespread pain was associated with higher scores or lower levels of anxiety, depression, physiological distress, etc. So really just showing how powerful sleep is for the body and the mind. Some limitations of this study was the reliance on self-reported measures for sleep quality. So this doesn't necessarily accurately reflect sleep patterns, and it can introduce a bias in the findings. Other possible confounders of this study include psychological factors. So we did state that depression and anxiety, which were associated with sleep quality and chronic widespread pain, may influence the relationship between sleep and pain resolution. So it's kind of like what came first, the chicken or the egg type of scenario here. Also pain severity. So the extent of pain at baseline, including number of pain sites, could confound the association between sleep quality and chronic widespread pain resolution. So this study did not have a very good definition of chronic widespread pain. They didn't have like a baseline criteria as to number of joints affected, pain scale out of 1 out of 10, with 1 being not very significant pain and 10 being very severe. So they didn't really have a good baseline to analyze this. And then also somatic symptoms and illness behavior. So levels of somatic symptom reporting and health-related behaviors may also impact the outcomes related to pain resolution and sleep quality. So again, kind of a chicken and the egg scenario here. So a very interesting article, really showing how sleep does have some really positive impacts on the body, but it's maybe not just sleep. It's really, the combination of sleep, mindfulness, anxiety, depression. All of these things are very interconnected and intertwined. So another interesting article. We do have one more article to take a look at tomorrow for our social connectivity pillar of lifestyle medicine. So I look forward to seeing you all tomorrow. Have a great day.